Chief executives can always learn from elsewhere, however good their current service is. There's bound to be examples in other healthcare systems in other parts of the country of hospitals are doing even better, whether we're talking about patient safety, clinical outcomes of care, efficiency, how well resources are used. So chief executives should never be complacent. They need to be inquiring, inquisitive, looking for best practice wherever it can be found, and then finding ways, this is much more challenging, of bringing that good practice back into their own organisations and applying it for the benefit of their services. Often in the health service, especially in England, we've created a way of working, a culture where chief executives are very focused on their own hospital, their own services. And there isn't a strong incentive to look outwards, to look upwards, to see what else they can learn from if they cast their eyes further afield. The way the system is managed, the way it's regulated, does encourage, at its worst, foundation trusts to think of themselves almost as self-sufficient, as fortresses. You know, when the going gets tough, the chief executive will pull up the drawbridge and try and make sure the organisation survives in harsh conditions. But we need to move beyond that, because the health service will only rise to the financial challenges, the quality challenges that lie ahead under David Nicholson's imperatives, if people are willing to look and learn from elsewhere. But there are many examples that I'm familiar with around the world where seeing the service through the eye of patients, of service users, has been very powerful as a way of improving the quality of care. Jönköping County Council in Sweden is one such example. Torbay Care Trust, focused around the needs of Mrs. Smith and thinking about how, when you improve quality of care, can you really make sure that patients at the end of the day receive a better service as a consequence? And if, by putting staff in a position of patients, service users, families and relatives, we can introduce that sort of mindset into the way the health service is run, I think that would be one very important way of continuing this journey of improvement of care.